One of the conditions that we treat in podiatry more often than people would think is lymphedema. People at risk for lymphedema include those with obesity, high blood pressure, heart problems, and diabetes, just to name a few, although it can happen to anyone. Those with the condition often seek the help of a podiatrist because they are unable to take care of their own feet. As experts of the lower extremity, not only do we take care of toenails, corns, and calluses and other ailments that are common in podiatry, but we also work in concert with the patient's other healthcare providers to help them deal with the swelling and discomfort that comes along with lymphedema. Here you can see the deep fissures that have developed in this patient's foot and ankle as a result of years of lymphedema. The skin changes that you see in this patient is called Elephantiasis Nostra Verrucosa. This is hypertrophy or overgrowth, thickening and hardening of the skin, leading to the disfigurement that you see. As the skin hardens and becomes less flexible, it makes it very difficult for the patient to walk normally. This can make wearing regular shoes nearly impossible, so when these patients go out into public, they typically wear slippers or house shoes. Here, I am applying antibiotic ointment into the fissures. You can see some areas of the fissures are red and raw. The antibiotic ointment will help prevent infection. The dark purple areas that you will see throughout this video are from a topical medication called gentian violet. It was prescribed by his primary physician. Gentian violet is used as an antifungal and somewhat of an antibacterial treatment. The only thing I don't like about gentian violet is that it stains everything: skin, socks, shoes, floor, you name it. There are other treatments available, so I choose not to use that. Another problem associated with chronic swelling of the foot, ankle, and legs is the formation of wounds. The chronic swelling causes seepage of fluid into the skin, and this fluid and other substances can cause breakdown of the skin and the formation of ulcers. Here I am gently debriding the devitalized tissue in the skin to clean off any bacteria, biofilm, and other bad materials so that this can heal. Again, I am applying antibiotic ointment to help prevent infection. Typically, these superficial wounds go on to heal very quickly, but if they go untreated or unnoticed and continue to get larger and deeper and involve more tissue, they can take weeks, months, or even years to heal. The excess fluid that would seep through this patient's skin caused the bottom of his feet to become macerated. That's white, thick, and very wrinkly. He had so much maceration that the bottom of his socks were soaked. So, I applied a lot of foot powder to the bottom of his feet to help control the moisture. Lymphedema also causes chronic swelling of the toes, making the spaces between them very tight. This tightness causes the spaces to retain fluid, leading to fungal and bacterial infections. So I also have to apply foot powder between the toes to control this moisture. A sterile gauze is applied to the wounds to help prevent infection and to absorb drainage. In these situations, especially when an ulcer is present, I like to use an Unna boot, especially in the beginning. An Unna boot is a special rolled gauze that contains zinc oxide and calamine. It goes on moist, but over a few days it begins to dry. That's why some people call it a soft cast. The Unna boot will retain compression the entire time it is applied. Now I am applying soft cotton cast padding to help provide an additional layer of protection to the skin and to protect the clothes and bedding from the seepage from the Unna boot's calamine and zinc oxide. A final layer of compression is achieved by using an elastic bandage. This will help further reduce and control swelling as well as protect the underlying Unna boot. This multiple layer bandage is a proven and effective first-line treatment for lymphedema and chronic venous diseases. I leave this bandage on for a week and then have the patient come back to reassess. If I see that the patient is making progress and the wounds are completely healed, then we can advance the patient on to other compressive therapies that he or she may be able to manage at home. These therapies include therapeutic massage, compressive socks, compressive stockings, and wraps. Of course, any underlying conditions such as obesity, heart disease, high blood pressure, and diabetes must also be addressed in order for lymphedema to be well controlled throughout the lifespan of the patient. Lymphedema cannot be cured, but it can be treated and controlled. So if you or anyone you know has this condition, it does not have to be suffered through. See a podiatrist, vascular specialist, or lymphedema clinic so that wounds can be healed, swelling can be controlled, shoes can be worn more comfortably, you can walk easier, and that you can function and rest much better. This is Kevin Jefferson, the DC Foot Doctor. Thank you for watching this video. Like it with a big thumbs up. To see very interesting cases and my approach and techniques to dealing with them, and to learn how you can improve your foot health, subscribe to the channel. Ring the bell so you will know when a new video has been uploaded. Follow me on social media at DC Foot Doctor. Most importantly, take care of your feet.